While still working on his Doctor of Pharmacy degree, Isaí Granados is already making an impact on his community. Granados, a pharmacy student at the University of Texas Pan American, volunteered at a local health clinic where he taught patients about eating healthy and making other lifestyle changes to control their diabetes.
One patient told me that they had no idea how much sugar was in a can of Coke because they would drink them regularly even if they had diabetes, and they had no idea how much sugar they were drinking. So I had a cup where I showed them how much sugar was in a Coke, and actually all patients were so surprised because they had no idea.
Granados is one of many UTPA students who spent at least a semester helping their communities for class credit. And recently, they displayed their work at the second annual Service Learning Showcase held on campus. Dr. Danica Brown, UTPA's Director of Undergraduate Research and Service Learning, says the volunteer work students do connects them with their communities while giving them the experience and the careers they plan to have.
They see the value of their learning in the university to their specific community. They see how it's going to apply for their career goals and their professional goals, and it's just more fun than traditional types of learning.
Brown says the university received a 5-year grant from the U.S. Department of Education to start experiential learning programs for students. So far, Brown says she tracked 1,000 students who have participated in service learning and estimated they worked a total of 3,600 hours and provided over $80,000 in service to the community.
Our community partners and the community members, our community organizations, are very excited about the potential of service learning because they see it as establishing relationships with the university, building their capacity to get volunteers out into the community to have impact on the community, to help them with really, they are on shoestring budgets and really do need help with building capacity. And they like the fact that in a service learning model, we're actively communicating with them about their needs to match them with our course needs, and so it's a reciprocal benefit.
Granado says he was glad his volunteer work allowed him to help make a difference in people's lives.
I'm glad that patients learned something new, and they were very excited to make these changes. One of my patients wanted to see me again in a month. She was so excited. She's like, I want you to be here in a month. I want to tell you how I made all these changes and how they've helped me. And so that made me very happy to know that I made a big difference.
I'm Jennifer Bergham reporting for UTPA.